These two descriptions, a valve surgery versus a minor procedure, imply very different levels of intervention.
Bom, naquele dia, eu havia operado uma criança que tinha síndrome de Crouzon. Era um pouquinho disforme, né? Tive que colocar uma válvula também.
In his 2023 interview, Dr. Ítalo explains that he performed surgery on a child with Crouzon syndrome and had to place a valve. Dr. Ítalo then confirms on several occasions that a valve was also placed in the creature.
Né?
Ele disse para o senhor que ele colocou uma válvula na criatura?
Sim. Foi o que ele me disse, né? Eu fui acudir como se eu estivesse vendo um outro paciente, né? E ele falou, pois é, estava assim, mostrou o vídeo, né? O pessoal vestido de jaleco, alguns de coisa cirúrgica, né? Eu coloquei uma válvula porque estava assim. Né? O que você acha? Eu falei assim, acho que está bem, né? Está tudo certo, né? Mas eu não vi o ser, né? Conversei com um outro colega que não está mais entre a gente e tal, que me disse, eu não vi, mas ele me disse que tinha colocado uma válvula, um ser diferente e tal.
When a hydrocephalus shunt is placed, the procedure involves more than simply inserting a valve. In standard neurosurgical practice, the valve is part of a complete drainage system that includes tubing placed into the brain and routed under the skin to another part of the body. In human neurosurgery, a valve is normally part of a complete shunt system designed to drain fluid away from the brain. Without tubing leading elsewhere, such as to the abdomen, the medical purpose of a valve alone is unclear. The operation usually takes around 45 minutes to an hour, although complex cases can take longer.
What was the nature of the surgery that was done on this being?
I think he only gave a few stitches. But I'm guessing, right? I didn't see him stitch it up. He must have stitched it up a few times, because the surgical instruments in the video were very small. He didn't have a surgical kit. He didn't have many open tools. Neurosurgery is all about boxes and boxes of open tools. Just like Formula One, you know? If my colleague took it there and stitched it up, it's because he must have been bleeding heavily. Blood is what scares lay people, right? It scares all of us, of course. But if it's bleeding, then, so if it went there and was taken quickly to that place, it must have been bleeding. That's what I think. Otherwise, it didn't need to be there. It was breathing normally. It wasn't in a coma. It wasn't intubated. Because critical patients get intubated. They get an IV drip. It didn't even have an IV drip. Nothing had been injected into it. You see? All I had was what would eventually happen. As I described, putting in stitches. That's why I think they took it to the hospital and then took it away.
What did Marcos Vinicius tell you about the being when he shows it to you? Did he give you any context?
He said I performed a procedure. From what I saw on the tape, there was a little basin like this, an emesis basin, and a needle holder. He probably gave stitches. It wasn't a big surgery. It was a small procedure.
While a single neurosurgeon may perform the procedure, it normally involves a full operating room team. This is why later, describing it as a simple procedure, or something comparable to stitches, presents a very different picture of what is normally involved.
So it's almost like he wanted you to review his work and just make sure that he had done the right thing.
Yes. Yes.
Did he take anything out of the head, or it was just, what was the purpose of the surgery?
I think it was only to give some stitches from the instruments I saw on the table. That I saw in the video, because when I went to look, there was nothing there anymore. It was covered up. It had already happened. That's why he said, come see what I've done.
Okay, so it was not necessarily surgically removing anything. It was just repairing.
No.
Okay.
Yes, to repair.
That makes sense, because if you have something that's physiologically very different than a human being, if you had to do something more intricate or complex on the organ itself, if it wasn't something you were familiar with, that would be much harder, obviously. Question I know that the audience will ask based on Michael's questions, which I think are great, is if you were brought in by Marcos Vinicius to review the surgery, because he's saying you're a more senior
No.
guy, you're a more senior neurosurgeon, I want you to check my work, why wouldn't you know the exact nature of that surgery?
Because I hadn't seen Marcos Vinicius yet. When she came in and asked about the alien, I'm out here, he's in there. There's no cell phone, I haven't seen Marcos Vinicius yet. I don't know what's going on in there. When I entered the hospital and went down to the pediatrics ward...
Not from the TV reporters before. That makes total sense. I mean, generally, like now, the specific surgery that was done, why don't you know those details, given that he was bringing you in to kind of check his work and review it as a senior neurosurgeon?
But it was to see if the patient was okay. That was it. Just to see if the patient was okay. Was he alive? He didn't go into detail about the type of surgery, because I think it was something so simple that he had no doubts. Just a stitch.
Ele disse para o senhor que ele colocou uma válvula na criatura?
Sim. Foi o que ele me disse, né?
And since I thought it was a very simple question from you, we didn't even talk about it. Apparently just to put a stitch in. I wasn't going to talk about that.
Ele disse para o senhor que ele colocou uma válvula na criatura?
Sim. Foi o que ele me disse, né?
It was like the next time you saw him, wouldn't you have been like, dude, what was that all about? Like,
Sure.
And you get, so you had that conversation. And what was that like?
Sure, but not at the moment it happened. What, with Marcos Vinicius? No, average patient.
Ele disse para o senhor que ele colocou uma válvula na criatura?
Sim. Foi o que ele me disse, né?
But afterwards, when did you first talk to the other surgeon about what you had about the alien?
I only spoke with Marcos Vinicius. We have other neurosurgeons there, and I don't know if they saw it or if they talked to him. But it was that sort of thing that you don't go into detail about.
Ele disse para o senhor que ele colocou uma válvula na criatura?
Sim. Foi o que ele me disse, né?
You don't speculate. If it were today, my God. What did you do? What stitch did you use? What kind of thread? But that was never the point of discussion. He tended to the being, it's alive, okay, next.
But the other doctor, did you speak to him afterwards about what he had done?
No, he said he did a small surgery, and look what I did.
Ele disse para o senhor que ele colocou uma válvula na criatura?
Sim. Foi o que ele me disse, né?
But given the location, everything was for a minor surgery, a stitch, something like that. They didn't have the necessary materials.
But like, you must have talked to the other surgeon about what he did to the alien afterwards.
No, he only said, look what I did. I didn't speak to him after about what he did.
Ele disse para o senhor que ele colocou uma válvula na criatura?
Sim. Foi o que ele me disse, né?